So this is our high flow system. This is OptiFlow Junior. We have different sizes from all the way, we have five different sizes for OptiFlow Junior: small, extra small, small, medium large, and an extra large. And then we have an extra large for the bigger size kit. This is all depend upon their nair sizes too. So this is one of the extra large, and this is mostly common for little more bigger size kids. All these are color coded in different colors. We have a
How do you choose them? Is it weight based or
age and patient weight? Sometimes those are depend upon their nair also.
Okay.
As some patients have big, their nair is bigger, then we have to choose from
Okay.
there.
Okay.
And the other one. But anyway, so these are color coded, and it's also on the side of the cover, which one you are choosing it, and it's also mentioned on the top. Extra large. This is extra large with the green. Purple is the large one, and this is the medium yellow color. Most common one we use in the pediatric ER.
Okay.
And the other one too, extra large also. We use quite a bit of this. These are good up to 25 liters. So usually when we start the high flows, we start from if it is less than 10 kg, we use the 1 liter per minute per kg. So it will be easy to calculate. And if it is more than 10 kg patient, then we start with the 10 liter, then go up from 0.5 liter per ml per kg.
Okay.
So if weight based, it will be easier to calculate.
Okay.
Then of course we have a blender here. You can go from 21% all the way to 100%. It's depend upon patient, how well patient is doing it.
Okay.
If the patient require a higher flow, then when we placing this on a patient, we start with the lower flow. Then after we insert it to the patient, then we'll adjust the flow according to patient.
Okay.
And just listen to the patient, see any airflow. Sometimes the too much flow more irritating for the patients, so they may not tolerate that well.
Okay.
Placing this on a patient, choose the medium size cannula for this our baby here, and there's like a sticker. You need to peel that off for placing this. Make sure it won't stick together, so it will be easier to go from one side to the other, and make sure it will cover up 50 to 80% occlusion, so that way you have better seal and it will have a better flow delivered to the patient too.
Okay.
And it will give it some sort of a pressure that is either like create a little bit peak also.
Okay.
So you have a better chance of getting a better result from this.
Okay.
If the patient is really fighting, and sometimes they pull these things off, and these can come off, and these are replaceable. We have different sizes. We have replacement stickers here. We can always replace just the tiger drum part.
Okay.
With these are the parts. We have that in our storage area.
Okay. Perfect.
So it's easy to replace just the tiger drum.
So nurses, if your patient pulls their high flow off, you don't have to call respiratory. There are replacement ones of these in the supply room, the respiratory supply room, and you can change them yourself.
And the most common troubleshoots that we have when we turn the humidifier on, it start alarming. That's because sometimes the temperature probe may be loose.
Okay.
Then maybe it came off, so the outside air get into the system, and the temperature reading may be a little bit higher on the chamber.
Okay, so make sure this is
Push it
tightened if you
tighten.
hear an alarm.
Right.
Okay.
So when the temperature probe came up, usually it will be there's no flow delivered to the patient. Everything will be escaping. So make sure patient is getting, maybe most probably the patient will be deciding also at the same
Okay.
time.
Okay.
The other area for more disconnection over here by the chamber, that's another area that may be disconnected.
Okay.
All we had to do is just push it in.
Okay.
Then if we had to give a NEP treatment, we will be able to do that through the aerogen system. We have the nebulizer.
So this is a special piece that has to be hooked up
Right.
if they're getting nebs? Okay.
Right. This is also we have it in our storage area.
Okay.
So it is available. And it comes in one kit, and all we have to do is just attach these two here and place it on the dry side of the chamber, so it will be much more medication delivered to the patient when it is go through the humidified air.
Okay.
The particle size will be lower when we nebulize it through the chamber too.
Okay.
And that's the reason why we put it on the dry side. When, of course, the aerogen need to be connected to the patient.
And does this
Yes.
come on all the high flow machines?
Well, I
Okay.
will say about 90% of the high flows has that
Okay.
aerogen in there. And all we need to do is just press the button on the side, and it will light up over here because it's not plugged in.
Oh, and it gives you the option for continuous
Continuous,
versus
right.
like an intermittent one?
Right.
Okay.
So if it is just intermittent one, then it will give you that. In case if you need to go to continuous, just hold on to this and it will change. There we go. Change it to continuous too.
Okay. Okay, perfect.
And we use the syringe pump to deliver the syringe pump. Let me go get a syringe pump. I'm sorry. Patient require continuous nap, then we use the syringe pump to deliver the medication
Okay.
to the patient, so they can give more medication, how many milligrams per minute or ml per kg, we can deliver to the patient too.
Oh, and there's special
Special
syringe and
syringe
tubing?
for tubing
Okay.
for this too.
Okay.
And this is come with the aerogen kit itself, and it is attached to the aerogen on the top.
Okay.
And this goes to the syringe pump. And we can program on the pump. So there will be a program under respiratory,
Okay.
number 7 on here, and albuterol for medication choosing. Then there will be a 2 different kind. If you want like a single dose, we can give a single dose, or we can give the continuous. So we normally choose number 1, which is more medication will be in the syringe. Yes.
So if my patient was on continuous and they stopped the continuous and then they are transitioning to the intermittent, we could still use this same syringe that you
If
have
you
set
want,
up.
yes.
We could just switch it to where it says
Yes.
intermittent. Okay.
Just say 15 milligram.
Would they need to change the dosing at all?
If it is intermittent, you can just push it in a little bit.
Okay.
Then it will nebulize it through that.
Okay.
That will be the easier way.
The easier way. Okay, than using the pump.
Yeah.
Okay.
And you can change the 15 milligram to 10 milligram, 5 milligram, and it will give you a ml per hour you are giving it.
Okay.
And of course, they need to be placed on continuous in order for you to deliver the continuous medication.
Okay.
If it is intermittent, just select the there's a 10-minute, 30-minute medication, then it will be good for it. Usually it will be done by after 15 minutes.
Okay. Okay. Now, if I stop my continuous, I can leave all this just
Yeah,
set up
you
like
can,
it is.
you
I
can
don't-
just
okay,
you can
perfect.
just leave it as it is. You can just turn off the pump,
Okay.
and you'll be fine with it.
Okay.
Nothing goes to the patient.
Okay.
What else we need? If the patient is still working hard and need to go up on the floor, you may be able to adjust your flow on the flow meter
Okay.
according to whatever the flow that you need.
Now, do you want the nurses, if I am increasing my flow, do you want them to just text page you
Yeah, it
for
will be
your
better.
like notes and everything?
Yeah,
Okay.
it will be better to let us know. So
Okay.
that way.
Okay.
Yeah. And if it is adult, I mean more than 12 years old or up, we may have to change the whole circuit to a different circuit.
Okay.
And because we are going to use a different cannula, because their nair is a little more bigger.
Okay.
That's why for this. So instead of using this, the adapter will be different for the bigger patients.
Okay. And will the
The
nebulizer?
nebulizer will be the same.
Okay.
Nebulizer will be same. The circuit will be different because of the higher flow you are delivering. Because in order to circulate through the through the patient to humidify everything,
Okay.
it does need a bigger circuit.
Okay.
It does have like a air entrament port here, and that's like a acceleration also.
Okay.
So do not cover anything over here on that time.
Okay. Okay.
Because of higher flow and the patient have a good seal around their nair. So this is also comes in 3 different sizes,
Okay.
and small, medium, large, adult size.
And I'm sorry, what was the age again, or?
I will say more than 12 years old.
More than 12 years, okay.
If their nair is bigger,
Okay.
then
Okay.
the lowest flow that you can deliver through here is 10 liter.
Okay.
So anything less than 10, consider as a low flow.
Okay. Okay.
So in that situation, we can go up on the flow all the way up to 70 liters. So we are going to switch this from here to here. So you can see all the way up to 70 liter flow if it is a bigger kid.
Okay.
And the same thing here too. Sometimes the patient move around and the temperature probe is disconnected.
Okay.
Then the temperature probe will be alarmed, and the heater will alarming also.
Okay.
Same principle here. All the other stuff is same except the circuit and the cannula.
Okay. Okay.
I think that's about it.
Okay.
Thank you.